Hello, guys. Today I want to talk to you about cluster headaches. I've done quite a lot of videos about headaches in the past, talked about primary, secondary headaches, talked a lot about migraine. And today it's time to talk about another type of headache called cluster headache. Before I go into the video, I'd like to welcome you back to the channel in case this is your first time. This is a channel that is dedicated to educating people about the brain and other aspects of the nervous system and the disorders that affect the nervous system. So, cluster headache, I think it's very important to put out some video about this very important type of primary headache because not uncommonly I see these types of headaches in the clinic. They are definitely not as common as migraine headaches, but they are certainly common enough to warrant talking about. So cluster headache is a type of primary headache. If you watch my previous videos, you would see where I try to distinguish between primary and secondary headache. So cluster headache is another type of primary headache, just like migraine, but it differs from migraine in several important ways. One is the fact that cluster headache is one of the most painful headaches known to man. In fact, some people believe it's the most painful condition people can go through, and some authors rightly call it suicide headaches. Now, when people go through it, what goes through their mind sometimes, I mean, you can't express them, and that's when people would even prefer to die because of how painful it can be. So I'll just describe what a typical cluster headache looks like. Typically, it's a headache that tends to come in clusters. So just more or less like the name suggests, a cluster headache. So unlike migraine, they can strike at any time, I may not have any particular pattern. Cluster headache tends to have a pattern, at least with the episodic type. So people tend to have these headaches, a lot of them, over a given period of time, let's say over a couple of weeks or over a couple of months, and then it disappears and tends to recur again, and it tends to be at fairly regular interval. So you have a period when the headaches are occurring, clustering together. That could be weeks or even months, and then followed by a period of relatively headache, a period of relative headache freedom, and then the headache recurs. So I've met people sometimes who have the clusters coming every year, or coming every winter, or coming every summer, or coming every 2 years or thereabout, and they come and they bother them a lot. They could occur multiple times a day when the cluster is going on. Sometimes it wakes people up at night, and it could actually follow a kind of irregular, timing, so that some people could have it waking them up at night at about the same time of the night. But usually people have multiple episodes a day. It can be as many as 8 episodes a day. And then a lot of them would have at least 1 or so episodes at night, and it tends to recur at about the same time. And then once these headaches bother the individuals who suffer it for a while, and then it resolves and then comes back during the next cluster. And when it's happening, it typically affects just one side of the head, and that's a bit similar to migraine, and that can be confused with migraine, but it affects strictly one side and centers around the eye. Of course, can also involve other part of the head, and it's excruciatingly painful. And then during the painful period, while the pain is going on, the individual might show other signs like redness of the eye on that side of the pain, like tearing. You might see tears dripping down the face. There might be even swelling of the eyelid, or even drooping of the eyelid, or the pupils getting small. or even big, you may see some sweating around the face at that time, or you might even see experience congestion of the nose on that side of the pain, or even some nasal flow. So all of these tend to accompany the headache, and the headaches are usually not so long, usually not as long as what we see in migraine. They're usually very brief headaches, usually in the range of 30 minutes to up to 3 hours. So that's the range. So, or it can be a little bit shorter. I think maybe the literature might say between 15 minutes and 3 hours. That's the range. So they're usually short. They're not very long like you have in migraine, but then you can have multiple episodes. So when people come to us with headaches that fit into the cluster phenotype, first we diagnose if this could be cluster headache, a cluster type of headache. Now, as neurologists, we do not just go on and jump on it and treat it as cluster. Everyone who has cluster headache must, as a matter of necessity, undergo head scan. I know a lot of patients ask me these questions when they come to the clinic. Doctor, do I need a head scan? I do not recommend head scans for everyone who's got a headache, but for cluster headache, if I ever see any patient who's got headaches that fit the phenotype of cluster headache, usually I insist that such a patient should undergo head MRI, because we do know for sure that there are a lot of potential mimickers of cluster headaches. There are other potentially dangerous conditions that can mimic cluster headaches. So that's usually the first thing we want to do. We want to do a scan and exclude mimics. And after that is done, then we go on to treatment. And cluster headaches are some of the most difficult headaches to treat. But usually we've got some effective medications to treat the attacks, to shorten the attacks. Usually we give some injections, like immigrant injection, for example, or even oxygen therapy to relieve, or even some nasal spray as well to relieve the acute attacks. And then simultaneously we combine with some medications that can help to reduce the number of attacks people experience during the cluster until the entire cluster is over. And then what I tell my patients is how to recognize when the cluster is over. So by experience, a lot of patients can tell how long their clusters tend to last. Those who experience cluster headaches, watching this video, they'll be able to relate to this. But what I see as a useful guide is usually when you haven't experienced any cluster for up to 2 weeks, then there's a chance that the cluster is already gone and you can start to taper off your preventative medication slowly. So what I've tried to do in this short video is to explain what cluster headache is, how painful it is, how to recognize it. And I've also established that those who have cluster headaches certainly need a head scan. And I've also mentioned what we do in terms of treatment of cluster headache, how that there are abortive treatments that can help to stop the pain when they happen, especially those ones that wake the patient up at night while they're asleep. There are effective medications to stop it. And then there are also preventative medications which we give during the cluster to help to reduce the number of attacks that would happen during each cluster, and perhaps to shorten the cluster as well. What I haven't said, which I should add very quickly, is why people get cluster headaches. So if after we've established that it's the primary cluster headache, it's not a mimic of cluster headache, because there are certain tumors that can mimic it. Now, the primary cluster headache itself, usually we think there might be a genetic basis for there might be a genetic underpinning. There might be certain, genes that people inherit or possess that actually put them at risk of developing cluster headaches. All right, so thanks for watching today. I do hope you learned something. Please don't forget to subscribe, share, and leave your comments behind. And I hope to see you again. Thanks for watching today.